An oncologist says New Zealand owes Southland man Blair Vining a debt of gratitude for the precious time he spent campaigning for a better health system before cancer took his life earlier today. Blair Vining, a father of two, was diagnosed with terminal cancer last year and was told even though he only had days to live, he would have to wait 2 months for an urgent appointment. Now, that prompted him to organise a petition calling for a national cancer agency, something the government has since promised. Oncologist Chris Jackson says although everyone knew this day was coming, it's indescribably tough to lose someone as selfless as Blair.
Blair started off as a patient, he became a collaborator and ended up a mate. He was a once-in-a-lifetime patient for me and a truly incredible guy.
Can you tell us when he died?
He died early this morning, so he was diagnosed last November and had known from that time that he was dying from cancer. And over the course of last year, he's fought incredibly and he's had a number of different treatments in order to help shrink his cancer and to keep it at bay. But it was always going to get him. And in recent days, it's become more and more apparent that the treatments that we'd been trying hadn't been working. And so we backed out of active treatment and he got home where he was able to be on his farm in his chair, surrounded by his family in the environment he wanted to be. So he was at home with his family and with people who he loved.
Back down on the farm, eh?
Yeah.
So that is a significant sacrifice when you have so little time left that you spend it battling for things to make things better when you know you're not going to be here to see that, isn't it?
He's the most incredibly selfless guy I think I've met. Many people, when they get diagnosed with cancer or have tragedy, ask the question, why me? Blair asked a different question, and that question he asked was, well, why anyone? And he set about trying to fix things for other people to make sure they wouldn't have to go through what he experienced. And his journey was so public, many thousands of people, literally thousands of people reached out to him and messaged him and shared their stories with him. And those stories deeply upset him and made him feel angry at the injustice of what people were experiencing and more determined to fix it for other people. Blair's philosophy was to keep things simple. And to get stuff done and to make sure that, as he liked to say, we kick cancer's ass and that we made a difference for all New Zealanders and to make sure that people wouldn't have to suffer like he did. He found it outrageous that we had a postcode lottery of cancer care around the country and wanted to see that people in his area got world-class cancer care and that all New Zealanders had the chance to have the same high standard of care.
Do you think that cancer patients are better off as a result of the things that he did and the public attention that he's drawn to the problem, particularly in Southland?
Well, undoubtedly. I think that what we've seen with the cancer petition that which he led, 143,000 signatures is a record for any kind of cancer-related petition in New Zealand. And the establishment of the Cancer Agency, which he specifically called for after our Cancer at the Crossroads conference, is truly historic. It's the biggest change we've had in New Zealand cancer governance in 20 years, if not ever. And other countries that have had cancer agencies have delivered some pretty major changes. And I think that if the Cancer Agency in New Zealand is given the same scope and the same rope, then it will do the same here. But there's a lot of ifs and buts. And when I sat with Blair last on Saturday, we spent time talking together and he knew the end was near. And I said, what do you want to see from here, Blair? What do we need to do? And he said, well, just keep your foot in the throat, don't let up and keep fighting and make sure that what we've started, that we complete this. And that's what we have to do.
So he was obviously involved also in trying to get a charitable hospital going. What are the core projects that you think Blair would want to see followed through to completion?
He wanted to see an end to postcode cancer care, so to make sure that all New Zealanders had access to that best quality care. He was passionate about getting people better access to colonoscopy as well, not just in Southland but also nationwide. And also over recent time, Blair became more and more aware of the gap in medicines funding in New Zealand compared to other countries, and that was important to him as well. He said he didn't think people should have to sell their houses to get access to a few more months of life. And he was aware that there were many people around New Zealand who didn't have insurance or financial resources that enabled them to have the same sorts of treatments that he was able to, and he felt that was deeply unfair too. And he wanted to see New Zealanders' access to treatments improved.
His wife, Melissa, graciously shared her husband with the rest of the country during his final months. How's she and the girls doing?
She's being well supported by family and friends at the moment, but we have spent a lot of time speaking over recent days and got to spend a lot of time with them both on Saturday. I think when you're losing someone who you love so much, it is absolutely utterly terrible. It is indescribably terrible, even though she's known for a year that he was dying. The pain of losing someone you love so much is just enormous. And while there is comfort in knowing that he has achieved an incredible amount in a very short space of time, perhaps more in a year than many people have achieved in their lives, still your soulmate, your best mate, someone who you care for so much, to see them dying at the end and slipping and fading away is just indescribably painful. And there are a lot of people who love her and who love them and are around them at the moment, and that will be of some comfort. But the pain, I think, just can't be understated, and people who've lost, other people who've lost people they love understand that completely.
I know this is still so very raw for you all, but how will you remember Blair?
Oh, in so many ways. Blair, so many ways. He was funny. He was incredibly humble, so selfless, and he was a great teacher. So a coach for the boys in his rugby team, when you could see him around kids, you could see just how he lifted and how he sparked. I will remember his calmness, his sincerity and his dignity, and I'll remember his selflessness and his sacrifice and his determination that people should not suffer. I think New Zealand owes him an enormous debt for what he has given. He's a truly remarkable man, and he's someone who I'm just so proud to call my friend.
And that was oncologist Chris Jackson. Blair Vining is survived by his wife Melissa and their 2 children.